Wikidonis.com. Truth about tooth.
We've been talking about a lot of crowns, and there are a lot of things regarding crowns, how we did the crowns. All these things are there in my other videos. Today we'll be talking about implant crowns. What is so different about implant crowns? Implant crowns can be of two different types. Most of the crowns are cemented, but in implants, most of the crowns are screw retained. So there is a small hole on the middle of the crown so that we can put a screw to attach it to the implant. The problem which we face most of the time is actually the loosening of the screw in itself. So what we do is we use a composite to cover the screw so that we can actually open it up if at all it becomes loose. The good thing about the screw retained one is actually we can remove it once in a while, and then we can have a look at the implant, and we can clean the area if at all there is some infection or something like that. We can actually remove the crown, clean the area, and once again fix it back. So that is the good thing about it. The bad thing about it, it can become loose. So we have another type of implants which can have the the cemented crowns instead of the screw retained crowns. So cemented crowns have the problem that it cannot be removed just like that. We'll have to cut the crown open and then only we can remove it. So that is the reason why most of the people are going for the screw retained ones. So these are the two different ones. But in general, we have the same crown types which is actually there as metal free, metal ceramic. All the crowns are available even for implants, and now newer materials like PEEK and composite based stronger crowns have come, which is softer on the occlusal load, but it is very strong to have it last for quite some time. So all these things depend on what is the bone quality, depending on how the force of the bite is. All these things determine what type of crown has to be placed on an implant. Why I tell you this is actually, we have a periodontal ligament which is actually taking all the shock of your bite in a natural tooth. But whereas in an implant, what happens is the load on the implant is actually transferred directly onto the bone. So if at all you have a traumatic bite, or if you are a heavy biting person, what happens is the bone will get lost after some time. If you give a zirconia crown on top of a very hard biting person, then you might lose the crown, or you lose the crown, you might lose the implant, or even you will lose the bone on that area. So in some cases even funny that the implant has broken because of the bite. So this is because of the wrong choice of the material of the crown, because the crown transfers the force from on the bite to the implant and onto the bone. So if you have a softer bone, if you have a implant which is actually thinner, so it is better to use a softer crown, like a PEEK material or a composite, or even a plastic crown can be used for that purposes, or an acrylic crown can be used. All these things, or acrylic denture can be used, so that the bite on the implant or the force on the implant can be reduced. So that is so important for the longevity of the implant, because you will be spending a lot of money on the implant. But if the crown is wrong, see, most of the time what I see is there may be persons who are traveling from different countries. They will be coming with an implant in another country. Sometimes, most of the time, I see a lot of patients coming from Thailand, Philippines, or Singapore. They go get the treatment there, and then they come here for the crown, and then they want a zirconia crown. But most of the time, what happens is the bone is very thin, or a bone is not very strong, and then when the implant is actually very thin, then to put a zirconia crown is actually suicidal for that implant. So because they have been paid a lot of money for that implant itself, or they might have done the treatment even in US. But to put a zirconia crown on top of that is not a great choice. But there are areas wherein we can put a zirconia crown on an implant. So it is a very tricky stuff wherein you have to decide which is the best treatment, which is the best crown, which is the best bone which is available for the best crown. So it's a marriage between the crown and the best bone which is there. So the best will be decided by the implant prosthodontist. So this cannot be done just like that. So there is a lot of planning which goes around. There are different materials which are available. Even a gold crown is softer than a zirconia or a ceramic crown. So between all these things we have to decide. But there are disadvantages and advantages. So implant crown in itself is actually a complex process. It requires a lot of study of the bone, lot of the study of the implant, what type of implant is there, what type of oral hygiene is there. All these things determine what type of material has to be used for that specific case. So thank you very much. Please understand that all these things, discuss with your dentist, your implantologist, your implant prosthodontist, so that you will get a better longevity for your implant, for your treatment. You have spent a lot of money. You want the best outcome for you. So I also want the best outcome for you. If at all you want to know more about this or more about your specific case, please don't hesitate to comment on this one. I'll send you my personal contacts and you can speak to me or contact me and ask any advice, because we love to hear from you. Please subscribe and send it to all your friends so that they'll also understand. If at all they are going for implants, please send it to them so that they'll understand different types of materials. And before you do the implants, please ask them what type of a crown is being placed, why they keep that crown for that specific thing, so that you will understand it much better than going and hunting for different types of crown which is not actually good for your tooth, your bone, or your health itself. So make sure that you have a safe crown which is actually having a good material, which is not having all these extra materials like beryllium and iridium and stuff like that. Make sure that you do a good crown which suits your aesthetic function. That is, in the front, if you have metal crowns, it is not good. So go for a metal-free crowns, and also make sure that you discuss with the doctor with all the possibilities, so that you will get a very good treatment and you will get a very good smile. Thank you very much. I am Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive, Kochi. Kochi is a very nice place. It is in Kerala. It is in India. It's the southernmost part of India. You're welcome down here. Thank you very much, Dr. Thomas. Here.
Wikidonist.com